Healthcare has been groundbreaking, reshaping the way we diagnose, treat, and monitor patients. I actually got the chance to see one way it's helping patients firsthand.
So what this does is that it scans your vitals, and we're able to see your health status by just the camera. We're able to see your heart rate, your breathing rate, your SpO2 rate, blood pressure, blood sugar, and blood cholesterol. Look at you, you're pretty good. Stress score, it shows low stress. Fatigue, your diet looks really good. Fitness looks really good.
Joining us now is functional medicine expert Dr. Cathleen Gerenger. Dr. Kathleen, that was fascinating. I mean, just a quick scan of my face and you had all of this information about my body makeup.
Exactly. AI is the future.
So how exactly does it work?
What it does is that with the scan and the camera, it's able, less than like 5 seconds, it's able to pick up your eyes. It's able to pick up that sympathetic and that parasympathetic nervous system, how our pupils able to dilate and contract. And there's so much information with our eyes and our skin, even if we have contacts or even makeup on.
Really?
Yes.
That is so fascinating to me. And what was also interesting is that you were actually on that particular day going over things, not as Gayle the host, but Gayle getting her blood work done. And a lot of what you were noticing on this scan matched up with what you were able to see with a blood analysis, which of course is very important and would not be omitted. But AI being complementary in the healthcare system is amazing.
It is, and especially in our healthcare, AI does so much, and I feel like that's our precision medicine. That's where we're going towards. And no longer personalized care, it's way beyond that, where what it does is that it has these algorithms, lots of data that it's able to abstract and look and see what your patient profile is. And the more we get to know the AI, we're able to diagnose things, and the patient's outcome will be so much faster and so much better.
You were just at a convention not that long ago. I'm all excited there. I was just like, I couldn't believe this was all happening. You were at a convention in Orlando not long ago, and you got to see firsthand how AI is making its way into the healthcare system. So what does the future hold for us? Because it's not in the distant future anymore, it's here.
It is here, and it is now. What it does is that from a physician's point of view, especially in the hospital environment, sometimes there's a lack of doctors and a lack of nurses. So what AI does is that it's able to scan your vital sign. You saw it. It's able to scan your vital sign, your blood pressure, your oxygen level, also your breathing rate, and now it's able to monitor your glucose without a finger prick anymore. So it frees up the doctor's time and the nurse's time, so they're able to take care of other clients and patients as well.
Yeah, because we are in a crisis in this country. There are not enough medical professionals to take care of all of the ailing people here. So if AI can streamline that, it can make a significant difference in how we're treated.
Yes, and the outcome would be so much better, decreases the hospitalization rate. For example, if it's in a nursing home, remember the pandemic and the shutdown, the doctors cannot get to the patient on time. So what if we have this AI nurse that's able to take the vitals, and all the doctor has to do is call in a prescription?
That's unbelievable. And for people that live in rural areas that don't have immediate access to health care, it's not like you're living in the Tampa Bay area and you can throw a stone and hit Tampa General or Advent Health or any of these incredible hospitals that we have here in the Tampa Bay area. So this would be a way to help people that don't have that advantage.
Yes, or telemedicine and a telemedicine platform, or even think about the airport, how we have to stand up and they screen us. What if we have something like that? They're able to screen our temperature. What if they're able to screen our vital signs?
That is just unbelievable. Anything else? Any other cool gadgets that you're working with, or you think you might get into your office when it comes to AI that you're interested in even?
Oh, absolutely. We're definitely going to incorporate that into our office, especially I'm always about, it's not changing the healthcare of America or the world, it's changing our mindset. How can we prevent things from happening? So just like a tool like we did at the clinic, What if you're able to have it at your fingertips, where you're able to be proactive with your own health care? What if you're like, hey, you know what? My B12 is a little bit low today. Can I supplement it? Can I bring it up? Or what is my sleep pattern this week? Am I stressed?
You're so right when it comes to preventative care, and this is something that people need to get on board with, because with the state of our healthcare system and our access to getting in to see doctors, it's very, very difficult. So the more you can do, from a patient's point of view, the better it is. And that way, you can just be healthy and not have to be waiting in doctors' offices all the time.
Exactly. And no, AI is not going to replace doctors. It's not going to replace healthcare providers. We still need to input that information in.
Okay, and Dr. Cathleen and I are also working together. She knows a lot of leaders in this field. They could be soon coming to the Tampa Bay area, so we're going to try to get them on Bloom, right?
Yes, absolutely.
I just threw that out in the universe, so it's
Okay,
happening.
it's happening.
All right, we're going to share Dr. Cathleen's story on our website.